Hello, everyone. This is Shane Lynn at MacArthur Museum of Arkansas Military History. We're doing our virtual interview series, continuing that. We have Dr. Jessica Domino. Dr. Domino, for the past 3 years, has been the PTSD Clinical Team Psychologist at Central Arkansas Veterans Healthcare System here in Central Arkansas. Before that, she was at the Lexington Veteran Affairs Medical Center and South Texas Veterans Healthcare Center. Dr. Domino, thank you so much for being part of the interview. It's, I think, a special interview since tomorrow we're doing this interview the day before Veterans Day.
Yes.
And I know you work very closely with our veterans and your staff does a wonderful job, but could you tell us a little bit about your role there with the Central Arkansas Veterans Healthcare System?
Sure. Thank you so much for inviting me. So I'm a staff psychologist at the Central Arkansas Veterans Healthcare System, and I work on the PTSD clinical team, which is our outpatient specialty clinic where we focus on treating trauma and PTSD within the mental health service. So I help with providing individual and group psychotherapy for PTSD that veterans kind of developed from their military service, different experiences that they might have had during their time in the military that is causing them difficulties now.
Right. And then also, are you in charge of the interns? Or the only reason I ask is
Yeah.
I've done a program for your interns there.
Sure.
And I didn't know if you were the lead with that, or I know you're the one that contacted me to do the program.
Right. So I'm not in charge of the interns, but I am part of both our internship, psychology internship, and interdisciplinary fellowship program. So I help coordinate kind of diversity and recovery training opportunities for them. And I'm lucky to have a lot of colleagues that can kind of help kind of build a really strong training program for them so that they can provide good services to our veterans while they're here doing their training and hopefully continue working in the VA system and providing that care.
Yes, well, I enjoyed the program I did the other day. So
thank you.
So I think most people are aware of PTSD, but for those who may not be, could you talk a little bit about what that is, particularly with our veterans?
Sure. So post-traumatic stress disorder, or PTSD, is a mental health condition that some people experience after trauma or a life-threatening event. And it could be something like a severe car accident, combat, sexual assault, or a natural disaster. So it can be a wide range of different things that someone could go through. And PTSD is a reaction that we sometimes see after that kind of event. I think one thing that's kind of important to know is that many of the reactions that we see in people are actually normal to see after someone experiences trauma. So if you experience combat or experience a life-threatening event, it would be very normal in the month or so afterwards to have difficulty sleeping, have upsetting memories or thoughts about what happened, feeling more on edge. And what we know is that most people, after several months, will notice these reactions begin to subside, but some people continue to experience those symptoms for a prolonged period of time, and they persist and are getting in the way of their day-to-day life, make work, school, family life more difficult. And that's when we might diagnose someone with PTSD. When we notice that it's really kind of prolonged reaction and getting in the way of things that are important for them.
Well, what are some of the treatments that and how folks can get better with PTSD?
Sure. So the good news is that we have treatments that we know are really effective in treating PTSD and promoting recovery. Where I work, we try to focus on evidence-based, trauma-focused psychotherapy, things like cognitive processing therapy or prolonged exposure. And these are treatments that we have many years of research showing that they're effective in treating veterans and civilians, and all different kinds of trauma. So it can be really helpful after combat and some of the other traumas that I mentioned. To talk a little bit more about those treatments and kind of what they look like, they are typically one-on-one with a therapist. The sessions focus on helping the individual process the memory of their traumatic experience or experiences, and the meaning it's had in their life, how it's impacted their life. Many times I think people, when they think about psychotherapy, they think I'm going to be, just in treatment for a really long time. This is something that really we can't do much about. But these treatments are actually designed to last for about 3 to 4 months. We can get a lot of traction and a lot of change in a relatively short amount of time. One thing that I think is important to know about these treatments as well is that they're not designed to erase these memories. We don't have that that kind of technology, and this is really just meant to help someone be able to change the impact that trauma is having on their life and improve their quality of life.
And I would imagine it's each patient, each person is different, the type of trauma.
Absolutely.
So how they go about helping them probably takes different methods to do.
Absolutely. I appreciate you mentioning that. I think one thing that's really important, and when we're meeting with veterans to, kind of discuss their treatment, what they're hoping to get out of it, and what they need, we want to take in account kind of their whole person and all of their experiences. And one of the things that we know about trauma is that, the different experiences that someone's had in their lifetime, they can add up. And so we want to know not just about maybe experiences or traumas that someone's experienced in the military. That's important, but also knowing, what kind of experiences they had growing up, so that we can make sure that we are, touching on anything that might be causing them problems now, and really it shapes the way that they see the world.
Right. And that's very important. Now, I know you probably primarily work with PTSD issues, but veterans can face other mental health issues. And,
Sure.
and could you talk about some of those and how some of those treatments may be different than the PTSD treatments?
Yeah. So definitely veterans, come in for a wide range of issues. Really common things might be just the transition into civilian life. That can be a difficult transition. Things like depression or anxiety, relationship stress, suicide, those are all reasons that someone or veterans will seek treatment. And within the mental health service, we have a range of, therapy, medication, other resources that we provide to help with those things. So there's a lot of things that people can do, and it's not necessarily going to be kind of like the treatments I was describing. A lot of times it's going to be helping people look at their day-to-day life now, problem solving, looking at things from different perspectives, and I think importantly connecting to things that are important to them in their life, things that bring value, like their family, work, and other things like that.
Right. Well, it seems in society today, there in as well as in the past, there's been a stigma associated with mental health issues. Do you find this to be especially true among our veterans?
Yeah, I mean, I think that much like, a lot of communities, unfortunately, there is stigma in the veteran community around mental health. I do think it's changing. I think a lot of people are doing great work, both in the military and in the veteran population, to try to change that, but it's definitely still there. One thing is that veterans are really resilient, and they're trained to endure some pretty difficult things during their military service. And also are encourage and not really just encourage, but they're supposed to put the mission first and put other people in front of themselves. And those can be really great things, but also make it really difficult to reach out for help for themselves. And so I think, helping veterans see that taking care of themselves also can help them take care of others, can be one way to encourage people to seek help and kind of break through that stigma. I also think, talking more openly about mental health can help with that, kind of like we're doing today. And, showing compassion and support when we hear people talking about their mental health struggles. Even, I think, just showing that can show the people around us that we care, that it's okay. And so, I think there's a lot of ways that we can help veterans feel more comfortable asking for help.
Definitely, that's one of the reasons I wanted to do this interview with you, is to help families or veterans, the families of veterans or veterans themselves who feel like they need the help to reach out and get that, because the VA does offer such a great support system for them. All they just need to do is take that step.
Sure.
And so, speaking of that, if a veteran or a friend of a veteran or family member of a veteran thinks they need help, what should they do?
Sure. So that's really the hard part, right? A lot of times we might see someone that we care about struggling. We're not really sure what to do to help them, where to start. And what I guess first and foremost, what I would say is, if you are worried about their safety, if you're worried that they might be having suicidal thoughts, don't be afraid to ask. I think sometimes people worry that if they ask about it, it's going to hurt the person in some way or put an idea in their head. And what we know is that's not the case. It's best to just ask directly. Say something like, I've noticed that you've been struggling or having a hard time lately, and I'm worried. Expressing that concern for them, and then just asking them, are you having thoughts of suicide? Putting it out on the table can really help kind of break that barrier and know what's going on. And if that is happening, then reaching out, to the Veterans Crisis Line. So it's 1-800-273-8255, and you press 1. And that is a great resource because it is staffed 24/7, and they can help make sure that the veteran is safe, and also connect with resources within the VA and the community. And if you're not, it doesn't just have to be the veteran that calls. If you're worried about a loved one, you can call yourself. You can talk to the person about what's going on, and they can help you problem solve that. So I think that's really important to know.
Definitely. I'm glad you brought that up, because it's not just the veteran who can call, but family members or friends who can call.
Absolutely. And you can also, you can go online. They have a way to chat online. There's a way to text the crisis line. They try to make it as easy as possible to reach out and get those resources in a way that feels comfortable.
If you go to the Central Arkansas Veterans Healthcare System website, I found that when you go on there, one of the little chat box will pop up and says, "Are you needing?
Yes.
Are you thinking?" And that's a great resource right there.
Absolutely. And then in terms, not everyone is necessarily in crisis, but still needs help. And if that's the case, I think, again, expressing that concern to your loved one can be a good place to start, and encouraging them to seek treatment. If they are already enrolled in VA, they can talk to any of their treatment providers, primary care, anyone else can help them get connected to mental health and the appropriate kind of services that they need. And veterans can walk in. They can walk in over at the Tobin campus in North Little Rock, or McClellan campus in Little Rock. During normal business hours, you can walk in and meet with someone that's going to help you be able to figure out what you need that day and get you connected kind of going forward as well. So I think that's really important to know for our veterans in Central Arkansas.
Well, we certainly thank you for the efforts that you go to help our veterans and the staff there. Just out of curiosity, how did you decide this is what you wanted to do to help to work with veterans?
Sure, that's a great question. Um, well, I mean, that's a good question. So I first got an interest in trauma and how it impacts people while I was an undergraduate student um, working in a domestic violence shelter. And so that kind of got me on the path. And then once I was in graduate school and was really focusing more on learning about trauma and PTSD, I got a training opportunity at a VA and I loved it. I loved working with veterans. Um, and it felt like a good way to be able to give back. I I have this training and um, our veterans really need people that can help them after they've served our country. And so it's a way I can provide some service to them. And I'm pretty grateful to be able to do that.
And we certainly appreciate you and all the folks there that are doing that. As we start to wrap up, is there anything that you would like to add?
Sure. I love to give a plug for the National Center for PTSD website, which is www.ptsd.va.gov. And I'm not saying that just because I work for VA. It's actually like within the PTSD community known as a fabulous resource. There are a just ton of handouts and videos and other types of information that can help veterans and other people who are dealing with PTSD better understand what they're going through, what kind of treatments are out there, and things they can share with their loved ones to help them understand too.
Right.
So I really like to let people know about that because a lot of hard work has gone into it, a lot of research and a lot of effort to try to get those resources out there, and they're wonderful. So definitely check that out if you're more interested in learning more about PTSD and treatment.
Right. And we here at the museum have often partnered with the VA, and it's we're a history museum, military museum, but we also care about our veterans, and that's one of the things that we do in June is that's PTSD Awareness Month, and we have a Movies at MacArthur series where we show films once a month, and so in June we always try to pick a film that deals with those issues, and the VA is gracious to send someone over to talk about and have a table available to talk to veterans and family members and friends to get help if they need it. Yeah. And I think that's just one way that we are, your outreach there at the VA, our outreach here at the museum, we're trying to hopefully, as we talked about, get rid of some of those stigmas associated with mental health, that if folks need the help, there's no shame in asking for that.
Absolutely. Absolutely.
We have a host of program. Well, it's not ours, but we're just the host site for a program called Freedom Sings USA, where Nashville, Steve Dean, a Nashville songwriter, will work with veterans and they'll write songs and music. And that's a way, I've talked to a number of veterans who said that was very good therapy for them.
Yes.
So there are many different creative ways to help people.
Yeah, and I think that that also brings up a good point. Like the treatment that we do in our clinic is sometimes one kind of step in someone's recovery, and that getting connected with other things to like songwriting or veterans groups in the community or other kinds of activities that can help people reconnect and feel less isolated and feel less limited, by things that they've experienced and they might be going through. goes a long way in terms of recovery. And so that's always something that I'm trying to encourage people to do is, you've done some really hard work in treatment, and this is very important. And what's next? How can you carry this further into your life, and what you want for your life now? Yeah.
Well, certainly thank you and the staff there at the Central Arkansas Veterans Healthcare System, all that they do for our veterans and will continue to do. I look forward to continuing our partnership and to doing interviews in the future or on-site
Absolutely.
outreach education. So thank you so much for being here, and we'll see you in the future.
Thank you so much for having me.
Okay, have a great day.